Yeah, he's getting a pressure ulcer. What stage of pressure ulcer is that?
Two.
Two.
Three.
Well, you can
Maybe
finish
3
the
or 4.
Well, by the time there's eschar, yeah, it's either a 3 or 4. All right, because it's just that dead tissue, so we can't tell. So we're going to have to debride it to know. But you know how patients get bed sores on their, or pressure ulcers, or decubiti, pick a term you want to call it, on their toes, is actually from the weight of the covers and how, like if you tuck the covers in really tight down over the top of their toes, that's enough pressure for some people with poor circulation, diabetics and the elderly, to go ahead and get a pressure ulcer. So one of the interventions for this is they have something called a bed cradle. Doesn't that sound funny? I love you. Oh yeah, so here's a bed cradle. So see how that fits over the bed? And so the purpose of that is to lift the weight of the covers off. This is an yes, I would like to see mine. Yeah.
I just got it this week.
Oh yeah. Cool.
Oh, tight.
Yeah, it's like you have to put together.
Yeah, I've never seen it like that. That's okay. Yeah, we can do that.
Yeah.
All right. So this is a bed cradle, and sometimes they're a square and sometimes they're a circle. This is an independent nursing function, and what you do about that is that and usually you don't have to assemble them, but we'll just do that. There's a supply room, and you and I would just go and get our bed cradle and decide to initiate this. This is an independent nursing. I'm going to look at the physician's order, and it says wound dressing change every 8 hours. Cleanse wound with normal saline. This one has other instructions, but we're just going to say do a wet to dry on patient Manning. Okay. And so then I would come to the room, and what do I do when I hit the room? I'm going to wash my hands. All right. And I'm actually going to put on my non-steriles, and I'm going to come up and say, good morning, my name is Jane. I'm your nursing student today. May I ask your name, please? Manning? Okay, great. And I'm going to look at the armband, all right, to validate that's true. Mr. Manning, I understand that you have a wound and need a dressing change this morning, and I'm here to check that out. Have you had that wound dressing changed before? You did yesterday? Okay. Was that something that was painful for you? It wasn't. All right. Are you in any pain now? You're not. Okay, because if you are, I would definitely want to give you something. All right. He's not. So I'm just going to look at your wound here. So I would actually just look at the location and size of the wound, because I just want, and I wouldn't be peeling it up or any of that stuff. I'm just looking to see what kind of supplies I need. Okay. Okay, thank you very much. I'm going to go out and get some, this bed should go down. I was trying to show you putting the bed up, put it down. I'm going to go out and get the supplies that I need, and I'll be back in just a minute to change your dressing. So lose this, wash my hand. All right, go out. And now I'm going to get one more set. Actually, I should have brought the garbage can from the door over here too. So now I've got my supplies, and what I have is my sterile wound dressing kit. And I would make sure this is a clean surface area. If they're plants, old yogurt, letters, teddy bears, flowers, or whatever, I would have to make this so that, thank you very much. This would be a good work surface for me. I'm actually going to move it up here. I wish this bed came up. And I could, if I thought there was soiling on this table, because there kind of sort of is, I would get one of those environmental wipes, and I could use that. I'd probably use it with my gloved hand. Hey, cool. To be able to ensure that this is a clean surface, and then I'd make sure it was dry as well. And so dressing kits, this one, since we're practicing with this, has already been opened, but the other thing I would check on my dressing kit is what? It's a sterile, yeah, exactly, because I want to make sure it is in fact sterilized. The way this would have been sterilized, because of all the objects in it, would have been gas sterilized, by the way. So it is current, and that's fine. I had some question about what was in there in a kit to know what other supplies I would need to get. You can see an actual listing of what's on any particular kit that you go get, any prepackaged kit. So I'm going to take out my sterile supply kit. And one thing I could do is, the fact is I don't want to take off a soiled dressing and wad it up and put it on the bed, or, oh gosh, where am I going to put the thing? I'll put it here, or put it on the floor, or anything. I want to put it immediately in a container. And the truth is, you could do this. I think you probably saw that on your ATI materials as well. Sorry, I had it done that. So I'm going to put that there because I'd like to put my soiled dressing in, because once I have it off, I got to do something with it. Okay. And now what I'm going to do is open my sterile kit. Remember what we said, that part of trying to maintain a sterile field was to not reach over things with the sense that, you know, hair or whatever, germs could fall off your body on them. So the mechanism, they're always wrapped in the same way. And I think that's kind of the advantage of having your own kit, having to use it and rewrap it, because that'll really cement that information in your mind. So the first flap you lift away from yourself, this one isn't wrapped particularly perfectly, by the way. And it doesn't matter whether you go left or right next. I should have stepped down, sorry. But the main point is the last one you want to do should come towards you. This should be actually like this. And your kit will look like this. My seniors, how could they not know? All right. She does get this kit back. Okay, so normally they would look something like this. So it would be away, side, side, and towards me. Okay? And I can handle just the little tiny outer layer, because what do I know about the little tiny?
1 inch
There's
border.
a 1 inch border on there that is not sterile. Okay. This is another sterile field that's on top of here. If I, in getting ready to do this wound change, ended up needing to get called away for a physician, or another patient needs me or whatever, I could actually remove the sterile field and I could cover this up, because what do I know about long-term exposure of steroid? Okay, that it could have
Contaminants.
airborne contamination. Another thing I could have used this for is plastic. So plastic side goes down. I could have actually used this, particularly if I was going to irrigate a wound and be spraying things around and so on, to place under the patient's wound to prevent splashing on the bed, in a sense to create a sterile environment. And I do frequently do that when it's near the perineum and so on, or up in an area where they're breathing and so on. I could actually do that. This kit doesn't have sterile gloves in it, so I'm going to go get some. But I'm looking at my kit, and what I can see is that this is a kit with 3 chambers, so I could actually put 3 solutions if it was needed in there. It's got swabs, it's got forceps, scissors. I can see my ABD, right? I can see my combined pad order. I can see packing material that I could use if necessary. There's tape, and there's my 4x4s. So I'm gonna, too bad I use that because I could put this on here. I'm gonna go get my sterile gloves here for a second. Sorry.
Pretend it's sterile.
Oh,
she has to show the technique.
There's what?
And
Don't film me walking over here. You say, what do you want?
Say hi.
tag.
Tag. Oh, got some. Yeah.
That's nice.
Okay.
That what you guys used to video your
Tiny
freaking
Dora
box
sailing.
yesterday?
Oh my god.
Oh no, it's my phone.
Okay, and so what should have been on top of here is also my sterile gloves. Okay, I'm actually going to move my sterile gloves over to the side so that I can put them on. And I need to pour solution into that tray. And I know I'm not going to pick that tray up and stick it against the person's wound, right? There's no reason why I would ever do that. So I'm actually going to handle the outside of this tray and dump things out to make that available. All right? So I can pour my solution. And
I know you're not going to look at that on that again, right?
no, I'm sorry, I'm just demoing.
No water near that guy. Here's
Okay.
sterile gloves.
Okay, so I'm going to check, is this my normal saline? And I'm also going to see that it expired. This is School of Nursing, so it expired 9/04, am I right? I'm teasing you. Okay, but what would I really know about this?
It's 24 hours.
It's whether it's 24 hours. If it's brand new, I could crack the lid here, in a sense, and can I just like do that? No. Okay, so I have to hold this or hold it upside down and so on, and I'm going to be able to try to pour without spilling, all right? Okay, and I'm going to put the lid back on,
That's
and then I'm
only
going to
15,
date it.
right?
What?
Only if it's
Those
you.
new, right?
This is new.
For the-
If it's used, what I'm going to actually do is
it out.
do this, where I'm going to pour it out a little bit to, in a sense, sterilize the lip on that, and then I would do that. Don't pour things from a really high height and so on, because you're more likely to spill. What if I spill? Then that, yeah, it's not sterile. All right. If I had opened this, I would now
Mark it.
Mark it.
Sign
my
it.
date, the time, and so on, and let people know. I just put my initials, JHRN, that I opened that and so on, so it's good for someone else who's going to do my next wound dressing. Whoa. All right. Let's see. Do I have what I need? I'm looking. I'm deciding. I think I'm good.